It's an honor, a great honor to be here today. And as I, earlier on joked with Hamid at saying it's been a long time seeing this happening. It's actually an idea that Hamid had around 2-3 years ago, but also has been substantiated by the fact that the global pandemic has taught us quite a lot of things around how to do and surveys well, and this instigated for the International Society of Addiction Medicine Board of Directors to approve this initiative. Next slide, Hamid, please. So what is ISAM, International Society of Addiction Medicine? It's an international collaboration of addiction medicine specialists. So the aggregate membership is around 10,000 individuals. And it's the motive and the mission is around providing and sustaining, improving evidence-based education, research, and policy-driven activities for not only one aspect of addiction, but for several components in addiction medicine that are primarily driven around improvement the competency of clinicians in order to improve the quality of the care of the patients that we serve. ISAM has different products. We have an ISAM textbook, which supports individuals who are sitting the ISAM professional certificate exam. We have several ISAM fundamental workshops around training trainers and leadership. And last but not least, we organize an annual global scientific congress with our fellow affiliated societies and local organizing committee. Next slide, please. We're very busy. We do lots of things, and this is really an example of the organogram around the International Society of Addiction Medicine. And as you can see in the center, there's the ISAM Global Experts Network, but of course, we have all sorts of different activities around education training, but with a view to instill and involve different members of the professional field, and especially those who are either directly or indirectly involved with individuals' substance use problems and or equivalent non-pharmacological dependence. As I mentioned before, we have the textbook, and at the top next week we have the annual congress, of course, in virtual form, between November 19th and November 21. We have around 50 symposia with 140 presenters, 11 plenary speakers, and 4 parallel tracks. Next slide. Part of the motivation to have a global expert network was around the fact that a component of the International Society of Addiction Medicine is the ISAM Regional Council, which Hamid is co-chairs. And as a result of that, we have around 25 affiliated societies and organizations who have all sorts of different numbers of membership within these organizations. But it stands to reason that this is an ideal platform to ask the experts within the field of addiction medicine, utilizing the pathways and the platforms that we already have, and the different types of networks that we've been forging through in the last 23 years of ISAM's existence. So I think this introduces, the notion of who we are and why we think it is the right time to do this, and in what capacity. It is ambitious, but in good old spirits, we do things in spite of, and we aim to do things well. So I hope you would enjoy this webinar and build on the experience. And last but not least, I am pretty confident the ISAM Gen will uphold the vision and the values of ISAM, and that is of, around innovation, excellence, learning, respect, collaboration, and diversity. Thank you very much.